And we're live. We're live. Dr. Mahoney, whenever you're ready.
Mr. Spiegel, are we live?
Yes, we're live.
Okay, great. Good evening, everyone in our Bergen Catholic community, and thank you for being with us tonight. On the call here, we have members of our coronavirus task force team, and we're able to come to you tonight from different locations and provide you with information about the reopening of school. Joining us tonight are school personnel, as well as members from the Holy Name Medical Center team that will talk about what we're doing from a safety and health and wellness protocol, as well as from an academic protocol. We're going to just go over some ground rules and expectations for tonight to help make sure that we meet all your expectations. Number one, we're going to try to keep this to about an hour. So we're going to look to conclude by about 8 o'clock. If there's still additional questions in the chat room at that time, we're happy to follow up with you directly tomorrow by email. And if you can email us your question, and you're welcome to email. If we run out of time tonight, myself or Mr. McElhaney would be happy to get back to you in regards to what we're going to do about the reopening of school. The second thing about tonight is to give you more information about how exactly we're going to do this from a logistical standpoint. And we're going to provide that information from you through a PowerPoint presentation done by Mr. McElhaney. We're going to begin tonight by giving you a brief overview from our facilities team.
Think we lost Dr. Mahoney?
I think we did. I think
Okay.
he was about to.
I'll take over.
Yeah.
And then we're going to be giving you information from Mr. McElhaney and the academics.
So let me start. This is Scott Hirschmiegel, Director of Finance and Operations for Bergen Catholic. Want to start by saying that, listen, our partnership with Holy Name Medical Center makes us uniquely positioned to manage this reopening. We're not only leveraging Holy Name Medical Center for their medical expertise, as most of you are well aware, they've been at the forefront of this pandemic since it started. But we're also developing hospital-grade cleaning protocols and using Holy Name Medical Center to procure hospital-grade cleaning products from both trustworthy and reputable vendors. There's 4 aspects to our sort of safety plan here that I want to talk to you about. The first and the most critical aspect of the safety plan is very low tech, but it's essentially utilizing the protective measures with the highest level of efficacy. That would be the things you guys have been hearing about since day one: face masks, hand hygiene, and physical distancing. As part of that, we're going to put increased signage regarding hand washing and social distancing throughout campus. We've placed hospital-grade hand sanitizer in every classroom throughout the building, as well as all hallways and common areas. In addition, we're putting plexiglass separators at all of the lunch tables in our cafeteria to allow kids to safely eat lunch. The second point would be to reduce the number of high-touch points wherever possible throughout campus and continue to transition into a hands-free environment. For example, one thing we'll do is we're going to have to turn off water fountains. We'll have the appropriate signage there, but the last thing we want kids doing is coming up and pressing the button to try to access the water fountains when they're off. Library books will be covered with the appropriate signage. What we'll do as well is remove unnecessary furniture throughout the building. That's going to do 2 things. And Mr. McElhaney will talk about this a little bit more. But first and foremost, it's going to help maximize classroom size. But to my earlier point, it's also going to help minimize the touch points within a classroom. And that point as well, what we're also going to do is we're moving towards hands-free soap and paper towel dispensers in all bathrooms to supplement what we already have, which is our existing hands-free sinks and toilets. The third part of this would be frequent cleaning and disinfecting. The entire campus will be cleaned and disinfected on a daily basis, including our buses. And what we will do with the high touch and high risk areas will be cleaned and disinfected throughout the day. So that's the cafeteria tables, door handles, handrails, things like that. The third or fourth aspect, I should say, of this would be ensuring adequate volume and quality of airflow throughout the building. So what we're doing is all windows on campus are going to be wide open. open during the day to allow for air circulation. We're making modifications to our HVAC system to increase the level of outside air coming in. And then finally, what we're doing is evaluating bipolar ionization technology that will allow us to further improve air quality. On top of all that, what we do is, and we've been blessed again to have this partnership with Holy Name, they will be having their entire maintenance team come to our campus at the end of this month to do two things. Number one, they will clean and disinfect our entire campus for us, while also doing a hands-on in-person tutorial for our staff, our maintenance staff, our cleaning staff, our cafeteria staff, to make sure that we have no doubts on what the best practices and protocols are. And we've actually been able to witness it and ask questions as appropriate. So with that, I'll turn it over to you, Dr. Mahoney.
Thank you, Mr. Hirschmiegel, and I'm sorry that my internet keeps cutting in and out. Dr. Tartikoff from Holy Name Medical Center is on the call, and he's going to go over some of the data-driving decision-making that we're using to make sure that we can reopen safely and at the percentages of 50%, and then moving on from there based on data in the Bergen County area. So, Dr. Tartikoff?
Yep. Thanks, Dr. Mahoney. First, I'm going to give you the luxury of my background. I went to the University of Pennsylvania. I attended that school on a senatorial scholarship. Upon graduation, I went to the Mount Sinai School of Medicine. After graduating, I did a year of general surgery at Mount Sinai as an intern. Then I did a year of residency at Montefiore and Einstein in orthopedic surgery. And after that, I did a 2-year residency in emergency medicine at New York Medical College and Lincoln Hospital. I passed my boards on 4 separate occasions, and I've done some other things. I've developed an app called DocChat. I developed a company called Air Ambulance, and I've done other things as well. But most importantly, I've been at Holy Name for 30 plus years. I've been the co-director of the emergency department for 25 years, and I am so pleased to be able to work with your administration at Bergen Catholic. It's been, number one, a pleasure, and number two, they have been so receptive to our information, and they have made it clear to us how important it is to keep your kids safe. When they first came to us, we were concerned about opening schools in general, and actually the administration came up with the idea of why don't we do it in stages, and immediately Dr. Mahoney suggested a 50% opening student body with a hybrid, and we thought that was a great idea. After doing some of our research and, of course, with the administration of Bergen Catholic, we came up with a plan which I think has been distributed to you, and I think it's just an excellent, excellent plan, and I think it'll keep your kids safe. But I'm really here to talk about COVID. And how COVID spreads and how we're going to mitigate the spread amongst your kids and your families as well. So I think the first and most important part is certainly wearing face masks. Surgical face masks are very good. N95s are the best, but awfully uncomfortable. I wear them all day in the emergency department, but I've gotten acclimated to it. I think most people really don't enjoy wearing them. Surgical masks are good. Cloth masks are probably the worst. So if you had a hierarchy, certainly surgical masks would be fine. Cloth masks would be at the bottom of that list. Just keep that in mind when you do go looking for masks for your kids and, of course, for your families as well. Secondly, social distancing. So very important. Particularly when in places like the cafeteria or in bathrooms. Those are places where, kids have to be responsible for staying 6 feet apart. I know Bergen Catholic has done everything they possibly can in their environment to make sure that kids do stay 6 feet apart, and they certainly have done a very good job of that. And my hat's off to the administration and being so diligent. I think it's a terrible error for any school to open up at 100% occupancy. I think that'll only spread the virus and maybe even lead to a second spike or certainly a bump. So again, my hat's off to the administration at Bergen Catholic. What you see in front of you is the New Jersey COVID-19 dashboard. It is kept by the Department of Health, and it really is a very good indicator of how rapid COVID is spreading in our state. The number, I'm going to direct your attention to the upper right-hand corner where you see the 9 red. That's not a good number, but that's pretty low relative to what we've been seeing. But more importantly, the light blue 0.92. Thank you. That is called an R naught, or what it really represents is the rate of transmission. So for everybody who gets this disease, they will give it to 0.92 other people. I'll give you a simple example. If I got the disease today, I would statistically give it to 1 other person if my rate of transmission was 1. And then it would just percolate along, never going away. If we have a rate of transmission that is less than 1, ultimately this disease will disappear. And in New Jersey right now, it's 0.92, which is really, it's a fabulous number for us to have. It means, again, that I am only going to give it to 0.92 other people when I get it. One of the examples I like to use is influenza. I'm going to be a little brief, but influenza's R naught number, or rate of transmission, is about 1.2 to 1.3. So you see, we are currently well below that. I believe we reached a high between 5 and 6 for rate of transmission. So for every 1 person who got it, they gave it to 5 more during, at least here in Bergen County, during that peak, and here at Holy Name, certainly. I also want to commend you on using Holy Name to help clean your premises and keep everybody safe. We have, oh gosh, pulmonologists, intensivists, emergency medicine doctors, all were very much involved in this COVID crisis, all very much on the front lines. We had 1 doctor who got sick, and he got sick actually before most of the COVID patients hit our hospital. So we've been pretty diligent in keeping our staff safe, and we're going to be equally as diligent in keeping your kids safe. If you would, can I see the COVID Act Now screen, Al, if that's possible?
Yep. Give me 1 second.
Sure. Great. So what you see here briefly is you see daily new cases, but more importantly, you see that the infection rate for this website, which is updated, I don't believe it's updated as much as the other, was 0.99 infection rate, and the positive test rate was only 1.2. So of every 100 tests, only 1.2 people ended up with the disease. For every 1,000, it was 12. So our reality is that we're really in New Jersey, we're making great headway. And if you could click on Bergen County, you would see that our infection rate is 1.04. Still very low. The positive test rate hasn't been determined for Bergen, but again, you know, it is really 1.2% across the state is fabulous. And we've been doing a very, very, very good job in New Jersey. So again, with the administration support, we opted to open up in a hybrid with 50% of the students attending one day and 50% attending the next. We think that is by far the safest methodology for us to allow your kids to be safe and your families to stay safe as well. It's very important that we practice social distancing, and I'm going to reiterate, it's very important that we wear masks. It is not a question of, you know, who you vote for. This is about public health and keeping our families in New Jersey safe. I want to thank you as parents. I am a parent as well, and certainly I understand how important it is to keep our kids safe. Thanks, Dr. Mahoney.
Thank you, Dr. Thank you, Dr. Tartikoff. May through sport, but Matt is going to be with our school nurse Kathy to make sure that every
Dr. Mahoney, you're breaking up.
I'm going to turn it over now to Tim McElhaney. So, Mr. McElhaney, would you come here, please?
Sure. Thank you very much, Dr. Mahoney. Just give me 1 second as I bring my screen into my PowerPoint presentation. Can everyone see that, Al?
Yes.
Yes. Thank
Yeah.
you.
Yes.
So everyone, thank you very much for taking the time out of your schedule to be with us this evening. This is an important conversation, and it's great to have you participate in it. I want to thank the Holy Name Medical Center staff. It's been great to have this group of professionals to bounce ideas and questions off of and getting information back at a tremendously rapid pace. So as we're looking at models and making decisions, we have them very much part of each of our decision-making processes. So thank you to them. I also want to thank the other members of the task force. This has been a lot of work over a long period of time. But certainly recently, as we're getting into the month of August and September is right in the forefront, everything is ramping up. So it's also been a lot of fun to be able to rely on this group of people as much as I've needed to, and they also have provided a tremendous amount of information. I'd like to start by where we started. When we look at everything we need to do to keep people safe, the 6 feet distance, keeping the kids 6 feet apart from one another, we needed to go into our classrooms and see what that looked like in terms of desks. Now, we have 36 classrooms, and when we look at the breakout in terms of capacity limits in those classrooms, 26 of our classrooms can hold 18 desks, and that's the largest number we have within our school facilities. 26 classrooms at 18, 2 at 16 desks, 5 at 12 desks, 1 at 11, and then 2 at 8. So that set our parameters. That's when we knew what we had in terms of our facility, and then what can we do going forward. So as Dr. Tartikoff mentioned, Dr. Mahoney was very eager that we look at a 50% hybrid model of reopening. So what that means simply is that on any given day, 50% of the student body would be in the school building, while the other 50% is home or in a remote setting. So we looked at what was the best way to gather the students. And for a period of time, we were looking at bringing in 2 full grade levels at a time. So for instance, the freshmen and seniors would come in one day, and then the sophomores and juniors the next. However, remember that number 18, the max number of desks that we can have in a room. That's where we have to work with. So when looking at our class averages, our average class size at Bergen Catholic is 21. The median is 23. So those numbers are higher than 18, obviously. So if we were bringing, let's just say, the full freshman class and the freshman geometry class sat down, it's possible there's 23 kids in that class. But the second I go to 19, I need to find a second space to house that class. And that's where our facility gets taxed. So we really couldn't pursue that model, meaning 2 full grade levels coming in at a time. And instead, what we had to do is what you see on your screen, is take a look at what we really did was go into each section. And we really didn't think the alphabet would work out the way it did. We were willing to make each grade level unique to itself, and the freshman you'll see is unique, but the other 3 grade levels all fell in the same range. But this allows us to have 18 or less students in each classroom when we bring half of the freshmen, half of the sophomores, half of the juniors, and half of the seniors in on a given day. So with the freshmen, it's A through K, sophomores A through L, juniors, seniors the same, A through L, and the second group are Group B, L through Z with the freshmen, and M through Z for the sophomores, juniors, and seniors. And what we're going to run is A days and B days, and it's not very complicated. On an A day, that signifies that Group A is in school and Group B is at home, and the very next day, B day, the Group B students would be in school, and the Group A students would be in a remote setting. So that's how we got to that decision of how we form groups. If you take a look at this, again, this is over a 10-day period, a 10-day view. And every 10-day period, each group will be in the building for in-person instruction for 5 days. And the other 5 days, they'll be home in a virtual setting. Now, I'm going to talk later about how we're going to do that to bring both groups together in terms of instruction. But I just wanted to show that over a 10-day view, 5 days in the building, 5 days in a remote setting. Here's our bell schedule. For freshman parents, this is just, doesn't mean anything to you in a sense of comparison to what we've had in the past. but for parents who have had students in the building for a number of years, it does look different. So what we looked at was a number of scheduling or bell schedule models. We spent a lot of time on the side-by-side or A-B block, where we would have 4 very long class periods, anywhere between 75 and 90 minutes per day, and rotate the kids through that. We looked at our traditional bell schedule, and we tried to marry it into what we needed in terms of timing. We had a bunch of other types of bell schedules that we looked at. A couple of things came into play, though. First thing is that 7 periods. The kids have 7 periods in our traditional bell schedule. Our hope is that at some point in the future, we are in a 100% model this school year. So we need to pivot out of whatever hybrid schedule we have into that bell schedule, that traditional Bergen Catholic bell schedule, without really, having to revamp everything. So we had to look at that. We also had to look at some of the anomalies that will be in the bell schedule this year. So, for instance, and I'll go into this in a moment, we need to conduct health.
They don't have. Yeah. Okay.
I'm sorry. Am I? So we need to conduct health screens before students enter the building. Now, as you can see on the screen, there's 45 minutes allotted for that, but I'm not sure if that's enough time. We're going to have to see how that goes in terms of a stress test. Now, what we do know is that for the young men who are participating in fall sports activities right now, it takes about 100 students to get through the health screen in 20 minutes. So that's a good number for us. But remember, not everyone's going to show up at the same time. So we have to figure out how that makes sense for us in real time. The back end of that is the announcements and dismissals. We just can't ring the bell and say, everybody go. So we have to figure out how to get the kids out in a reasonable amount of time, but in a safe way. So that 15 minutes may be appropriate. It may need to be a little bit longer. So that's something we had to consider. And then our lunch periods. Again, for those parents that have been around for a while, we have traditionally run 30-minute lunch periods, but now we're running 40-minute lunch periods. One, because we have to get them down in a different way to the cafeteria. We have to move them through the line in a different way. And that's going to take some time. And if we need to adjust, we're going to adjust. So what you see here is what we think makes sense, but come the first week of school, after the first week of school, you might see some tweaking. So what we have decided to go with is a 5-period day. And what it looks like in terms of cycle and rotation is that over the 7-day period, every class will meet 5 times. So 7-day period, every class meets 5 times. And as you can imagine, every class meets in each of the periods. So there's nothing, not one class getting a much longer period of time. Just to jump back for 1 second, when you look at this model, period 1, 2, and 5 is 45 minutes in length. So those are periods that we're very comfortable teaching. At Bergen Catholic, in a regular bell schedule, we're at 50 minutes, but at an activity schedule, we're at 43. So this falls very nicely in a range for us that our teachers know about and our kids know about. The lunch period, again, is typically 30. But remember, if your son wasn't eating lunch during the period, he would have his class for 63 minutes. Now, in this version, if he's not eating lunch in period 3, for instance, he would have his English class for 85 minutes. Now, that's certainly longer than 63, but it's one of these things we're going to have to utilize to our advantage with different types of instructional strategies. This could be a time in which we do projects or testing or something. It's certainly going to be an advantage and not a disadvantage to us, but it is certainly a longer period of time. But it's 1 period out of the day, both for the kids and for the faculty members, in which they're going to need to engage. And as I said, when looking at the other models, this model, though, makes the most sense for us. So 5 times over 7-day period, and they'll fall in each of those period blocks. So no one's getting the 85-minute block, if you would, 3 out of 5 times. Period 1, 2, 3, 4, 5 for every class that your sons will be in when we begin in the 50-50 model. Big point for us is entry. How do we get the kids in, and how do we get them in safely? So first things first, we're going to have 5 entry points, and we're going to ask our classes to divide. We'll make it obviously known to them where they need to come to enter the school building. So for freshmen, there's a wing that we call the wing, the only 2-story part of our school. And the wing door, the freshmen will come in as closest to Woodland Avenue. Believe me, we'll mark this so they know where to go. The sophomores will use the wing door nearest to Ordell Avenue. The juniors will come through the guidance office and do that and enter that area through the parking lot. The seniors through the gym lobby door. And our staff members need to do that as well, coming in a space that's unique to them. And that will be the main office entrance. And we're doing this because, one, we're positioning the entry points nearest the classroom in which they're going to be housed, shown in a moment. And also, we're going to conduct health screens. So what we're going to do is ask prior to leaving the home that you just, and Holy Name will send out a questionnaire, but functionally is, how does your son feel? Does he have a cough? Does he have a runny nose? Does he have a fever? If he answers yes to any of those questions, he should stay home. You should keep him home until you're sure that really it's something mild or something that isn't related to COVID. But we're really asking you to be pretty good about doing this every day, for yourselves, but certainly with your sons before they head out the door, either to get in the car or get on the bus. When they get to Bergen Catholic and when they get to one of those 4 entry points and the 5th one for faculty, we're going to use something called the Safe Space Screen. It's an iPad-like device that has facial recognition and infrared temperature scans is what it accomplishes. And nicely, it records and stores all the data. You also don't have to touch it. So the kids will just put their face in, they'll be scanned, and then they'll move through. If it notes he has a fever, we're going to direct him to what we're going to signify as a COVID room. That's going to be staffed with a medical professional. They're going to get the temperature taken again. If the temperature is still above 100.4, then we're going to call the parents and ask them to come and get him. In that time, though, Holy Name is a resource and can do a telemed visit, could set up testing if that's something that the family would like. And I think you're going to feel very comfortable in the way that we handle it. We're not going to embarrass a young man. We're not going to shout he has a symptom. We're very quietly just going to direct him to the COVID room area and then ask for a second screening of the temperature and then call the parents if need be. And again, Holy Name is a resource throughout this entire period. Just as mentioned earlier, other health measures we're going to use. Masks will be worn. There's going to be shields in place in the cafeteria, mounted hand sanitizers the kids are going to be using all the time, backpack sprayers that our maintenance department will use after school to sanitize and disinfect every area, and the water fountains are going to be disconnected, which helps with not only COVID but with flu. So now, we have the ability to segment out our school in 4 areas. Now, I want to say a lot of parents have raised the point, can't you just put 25 kids in a room and have the teachers rotate to them? In high school, that model really doesn't work. For instance, we offer 3 math courses at every level. And I don't mean college preparatory and honors, 3 different types of math courses. For the easiest one, we offer 3 different types of world languages. So to rotate a math person in, sure, but that day you'll just get math. You might not necessarily get the math that you are taking or supposed to be taking, but we could give you some type of math. So I'm not trying to be silly, but it just doesn't work at the high school level with all the courses we offer. So what we're going to do is we're going to break the building into 4 areas. Again, these are linked to the entry points of your students. And you can see the seniors will be in 9A through 16. That's functionally a hallway. The juniors are functionally in a hallway a little extended. The sophomores are functionally in the same hallway. I keep saying functionally. These bleed a little bit into some other areas, but nonetheless, we're keeping them very tight to one another. So when we release them from class, they're not going to be mixing and matching with everyone. They will be mixing and matching with their grade level classmates, that group that is in that day with them. But we're not sending them across the building or here or there where they're going to make contact with everyone else. So we're also only going to release them with masks on. Masks are on during the class, and masks are certainly on during the passing time. So that's the way we're going to break the building out or position the students throughout the building during the school day. Some additional spaces that need to be converted. Our robotics lab is very nice, but with the 6-foot distancing, we can only get 8 students in there. And every freshman and sophomore takes robotics. So we need a larger space. So we're going to utilize the library for that. The art room is a wonderful, well-lit, fun room. But because of the bolted furniture, we can only get 11 students in there 6 feet apart, if you can believe that. So we're going to move that to the wrestling room for the first part of the school year. The gymnasium needs to come and become 2 at least half of it needs to become 2 instructional spaces. Our PE program is going to be different, at least at the beginning of the school year. While we are going to have teachers bring kids down to the stadium and have them walk around if they like to stretch their legs, we're not going to ask them to change into their gym uniform. We're not going to be engaging in activities that require the use of a ball or contact. But there is some for aerobic workouts, we could do that. But again, with their school clothes on, what we might do at times, and what we will do at times, is have them stay in the gym in those 2 instructional areas. And we're going to talk about nutrition. We're going to talk about health. We're going to talk about a topic on the day. We might ask the college counseling department to come down and do something with them on a particular period, or the guidance department. We're going to utilize that time in interesting and fun ways. But I want to share that the PE program, at least initially, is going to be different. And then I have to create faculty spaces so they have a place to go. And that's where we're going to utilize the robotics lab and the art room to give them some space to prep for classes and to grade papers and so on. So now teaching and learning, and this is what I don't mean to put it at the end, but I know this is what people want to talk about. So when we have group A in the building, so for instance, the freshmen are in a geometry class, half of them are sitting there while the other half are at home. Now the bell schedule that's in the building is the bell schedule that will be used at home by those kids in the remote setting. And what we're going to ask them to do is to log on, and teachers can either use Blackboard Collaborate, which they used last year, or all of our teachers this year have Zoom Educator accounts. The teachers can decide on any given period which one they would like to use, just inform the students so they know where to go. We're going to have webcams in every classroom with a tripod connected to a 7-foot extended tripod. And the tripod gives the flexibility of the teacher to move the webcam into a position and orientation that he or she would like that can best capture the room. Because the students at home are going to view the webcam and be able to see everything that's happening in the room. Or if the teacher would like to point it towards the board, they could see what's going on in the board. They could hear everything that's happening in the room. Teachers will be either using Bluetooth earbuds or Wi-Fi microphones, so that we have no loss of volume as the teacher moves throughout the room. And I think it really makes a nice opportunity for the kids to be able to engage with the classroom atmosphere. They'll be able to ask questions through the chat. They'll be able to ask questions verbally, again, depending on the expectations of the teacher. We're going to have to, get into this a little bit and have some experience with it, but we're going to have the opportunity to give the kids at home the real feel of the classroom through the webcams and through Blackboard Collaborate or Zoom. And I think they're going to find it enjoyable. So again, the bell schedule being followed in the building is the bell schedule that's being followed at home. There is no difference in any way. The opening week of school, we've backed it up 1 day. So what you'll see here is we're going to do everything on site. We're going to have our faculty meeting the Tuesday after Labor Day. We're going to bring the freshmen in for orientation on that Wednesday, the sophomores on the Thursday. We're going to bring the juniors in on the morning on Friday, September 11th, and then ask them to leave. We're going to sanitize the building and the space, and then bring the senior class in for their orientation. Now, Friday, September 11th was to be the first day of school, but because we've extended the orientation process, the first day of school is going to be Monday, September 14th, and that's going to be an A day. For those that have been here in the past, we typically start with a half day. We're not going to do that this year. We're going to start with an A day. So the A group will be in the building for a full day, and the B group will be in the remote setting. And this is the last slide, I promise. We understand that some parents have a concern about their sons coming to school, in this environment, meaning the COVID environment, not Bergen Catholic. So we're going to send a Google form home within the next day or two, asking families to fill it out for those that would like their son to be in a remote environment the entire time. And that's fine. Just a couple of things. If you choose to do that, which is absolutely fine, and I think he's going to get a very similar educational experience. There's no substitute for the in-person, but we're going to do the best we can to make it as great as we possibly can for him. The only thing is, if you decide to do that, it can't be a day-by-day or week-by-week basis. If you make that decision and elect to put him in a full remote environment, then he has to be in it for the entire first quarter. And that's from Monday, September 14th to Thursday, October 29th. We'll send out another Google form on October 21st to ask what people are feeling. And then if anyone selects to put their child into the solely remote environment for the second quarter, then again, like the first, he would have to stay in there for the entire second the second quarter. We can't move kids in and out because we are basing decisions on where we're putting classrooms or classes in classrooms based on numbers. And if all of a sudden 3 kids decide to come back, then we might have to move from a classroom of 14 to a classroom of 18, and we just don't have the ability to do that. I hope you can understand that. And I do want to share, for anyone that selects to go into the full remote setting, then you can't participate in athletics, or you can't participate in activities that function in person at some point. That doesn't mean the day you're home in the remote setting, that doesn't pertain to you. If you're doing the rotation A and B and in and out of the school, if you're home and remote, you could certainly participate in athletics or an activity that might at some point, meet in person. This is for those that choose to go fully into the remote environment. So that's what I have. I'm sorry for the length of it, but I hope it was helpful.
Thanks, Tim. Hey, can I ask one thing? One of the tremendous benefits that we get from the Holy Name Medical Center team is this access to rapid COVID testing. Dr. Tartikoff or Matt, would you spend a minute or so just talking about that and letting everyone understand what that's all about? Thank you. Dr. Tartikoff, I think you're on mute.
All right, that's better. Matt, why don't you introduce yourself? But I'm briefly going to tell the parents that Matt Hopner and I have worked together for 10 years in the emergency department. He is a true extension of my arm, my ears, my eyes, and more often than not, my brain. So I'm going to leave this for Matt to discuss.
So I would love to say that I had the experience at UPenn in my 2-year ER residency, but I did have a 10-year residency with a really bright, really rough attending. So I feel well equipped to take care of all that comes in. Now, the beauty of what we're going to end up doing is evaluating the patient throughout your students, your sons, remotely, and try to figure out, is this COVID related? Is it not? If it may be, I can easily facilitate outpatient testing. We have access to rapid studies. It takes about 2 to 4 hours turnaround time to get a result. It is a PCR study. It is the most sensitive study that is available. So it's highly reliable, very quick. Worst case scenario would be based upon time of day. If we couldn't get a rapid done, then we'd get a result within 24, 48 hours tops. Other sendouts take 7 to 10 days. So, this is something, a great value added in terms of evaluating for COVID-19, but not only will the conversation pertain to COVID-19, what are the other possible causes of these symptoms? That's the way we're made. I am concerned about COVID, but I'm more concerned about the welfare of the student and being bright, making sure that they're safe.
Okay. Thank you both. Dr. Mahoney had to drop off. He didn't want me to say, but he still has dial-up. So his internet isn't that great. But what I'll just do is we'll run through the questions that are in the chat. If anybody has questions they want to throw up there, and I'll just kind of throw them out I'll put them up on the screen and whoever appropriate to answer them. So the first one is for Mr. McElhenney. It's the earliest our son can be dropped off.
So we're going to work on that. We have an issue there though, and 7:30 may not be the right time. Historically, our building is opened at 6:15 in the morning to accommodate those families that have commuting issues, particularly parents with an early work time frame. We're absolutely not going to be able to do that this year. So we're not going to be at 6:15. For our scheduling, at least the drafting of the schedule, 7:30 was the number. That number might be too late, and I understand that. So we're going to do some view of that and take into some consideration. But what I want everyone to realize is if you were arriving before 7 o'clock, we're just not going to be able to accommodate that with health screens, activating the COVID room, putting into play all the things we need that are so different this year. We understand that's going to be for some a difficulty. We're going to look at that 7:30. Again, that's a number we just put, I know we shared it, but I think that number is going to have to come a little bit earlier. But again, it can't be 6:15 in the morning anymore. But I'll have more information out to you when I can about
Okay, another one for Mr. McElhenney. When will schedules be released?
So this was a very unique summer for us, and our master build took a while as we were trying to look at classrooms and keeping class sizes at 18 or less. So we did complete the master build. That means the master schedule build. We're working out some conflicts with a number of students. Our hope is that we're able to release those schedules very soon. We understand it's mid-August right now, but I hope everyone can understand, based on the model we're using, we had to do this in a different way than we've done it in the past. That doesn't mean we can't get them out, and we will as soon as we can. We are working through a number of conflicts with a number of families. Once we have that completed, we will release the schedules. Again, these are line schedules. This isn't with teachers attached. Those schedules don't come out till the very, very beginning of the school year. That would be September. But line schedules should be out shortly, meaning you'll see what classes you're in, not what teachers you have.
Okay, the next one I'd say for either Mr. Hirschmugle or Mr. Kerpick, what are your thoughts on cloth masks with the ability to replace carbon filters every 7 uses? And also the Holy Name folks could probably chime in on this as well.
Dr.
And you're
Tartikoff,
muted.
I think you're on mute. Yep.
The answer to that is I have to do a little bit of homework. I'm not familiar with that particular 3M product. Carbon filters usually are okay, but again, I have to do a little bit of homework. Matthew, I don't know if you know anything about that particular mask or anybody else in this group.
Unfortunately, I don't, but I can find out.
I actually wrote it down, and we'll get back
Yeah,
to you, or we'll get back to the administrators, and they can get back to you as well. But we'll see if where that stacks up with regard to N95s and surgical masks.
Can I add in? I believe I've seen before if you go on the 3M website, I think they break down all their masks, how they are. I believe I've seen that before, but I can't say exactly the charcoal filters, but I know that they have everyone broken down from N95s and let you know the difference.
Sure. It's funny. I just quickly got on and quickly went through and couldn't find it, but I will certainly address that. We will certainly address that, Matthew and I.
Yep.
Okay, the next one's for Mr. McElhenney. At the last town hall meeting, it was mentioned that all students would be in the school 1 day per week. 1 day per week. Is that no longer the case?
Yes. So, after that meeting, and obviously we're evaluating everything day by day. We had more conversations with the Holy Name Medical folks and realized that bringing 100% in was not the wisest move, particularly earlier in the school year. However, we are committed to bringing grade levels together. We're working out how to do that. We know how important it is for camaraderie building, friendship building, culture, of one another to be around each other. So we are committed to bringing the grade levels in to meet, build friendships, relationships, and so on. We just can't do it at this point in the model of bringing the entire school in on 1 day. But it doesn't mean we won't bring the grade levels in totality to build those relationships. And we're working on that process now.
Okay, if I'm so lucky to have my son go to school remotely 100%, what is the rationale for him coming into the school for orientation? Mr. McElhenney?
So if you elect to have your son in the remote environment 100%, then he will engage in the orientation remotely. My expectation is that, and again, it's obviously a family decision. Just when I noted that, my assumption was that the majority of kids will be in the AB grouping model, that 50% model. So for those folks, we won't have 2 orientations by grade level. Everybody will come in for 1 on that particular day. But if you are electing to go into the full remote environment, that process or that event will also be fully remote for you, and we'll stream it to you.
Okay. For the upperclassmen who choose electives, will their selected classes remain the same, or has their course schedule been adjusted to accommodate the school schedules?
Everything is the same in terms of electives. We do have some electives every year that are not very popular, and as a result, they can't run. I don't think that happened this year. So nothing out of the normal occurred with senior electives. The other side of that is some are very popular, and depending on numbers, we may and when they signed up for it, we may have to knock him into his second choice. But no, the hope is that didn't happen. But again, no, nothing has been altered in terms of the offering of electives or the number of sections that we offer in terms of our core course sequencing. So the answer is no.
Okay. If the students begin with hybrid model but wish to switch to all remote learning, is that option available?
So that option is available, and we could do that much easier than bringing someone back into the building. Ideally, we wouldn't like to deal with this on a daily basis, but we understand, we don't know where this is going. Our hope is those numbers keep dropping and more people want, to be in the building than outside of it. So if you have a feeling that you want your son to go from the A-B hybrid model, 50% into the remote, we could do that very easily. It's the other way that we just can. If you elect to be in a remote setting, that has to be the selection for the entire quarter.
Okay. The next one is, I'd say, for Dr. Tartikoff, because I know we've talked about this. Are students required to wear surgical masks? My son prefers a bandana. Would that be acceptable?
The answer is it's a N95 is best, a surgical mask is second best, and cloth masks are not nearly as good. It's still a mask, but statistically, it doesn't protect your son or others nearly as well as the other two masks.
Okay. The next one is for Ms. Walter, who is our Director of College Counseling. Could you please speak how you see the impacting the work with the seniors on college visits, applications, and counseling?
Yes, hi. So I know that I've spoken with a lot of the senior parents in the spring going into the summer, that we had personal one-on-one appointments. But for those of you that don't know, we are able to do the majority of the college visits of the 100 plus colleges that come to Bergen. We will still be doing all of those visits, except they will be virtual. So when your son signs up to visit, say, Villanova, they will receive a Zoom link that the representative from the North Jersey area will come on, and I will be on as well. So I'll facilitate questions just like I would if we were in person. And your sons will be able to interact with the person on the other end, just like they would if they were sitting in person. So as of right now, all of those are remote, and that is a combination of both Bergen's position, but also the college's position. They don't want to send their representatives all over the country. So they have chosen to do the remote visits. So that's how it is as of right now, set up at least for September and October. We do have several visits booked. If you go onto your son's Naviance account, you can see under the upcoming visits, everyone that's listed. So they're all there. In terms of the work with seniors, anything that I can do via Zoom, I will. In terms of Common App college boot camps that need to be done in terms of doing applications, certainly anything that can be done remotely, I will, but I will still be available for in-person visits for students that might need additional assistance. As of right now, I'm planning a parent night for September 22nd, in which I will be going through the college application process. I still will be hosting a financial aid night for parents, and then for all the other grade levels, as I would normally. Obviously, as of right now, the situation changes so frequently, but we have the ability to do it either virtually or in person, depending on what the situation is at that time.
Okay, thank you. I think that answers the next question as well. Will students be required to have their camera on when they are remote? That's, I'd say, Mr. McElhenney.
Yeah, the expectation is yes. Some of this is teacher preference, and some of this is internet capability and what's going on in the student's home. The hope is that having them on, enhances the experience, and that's what the teachers hope to do each period. Zoom admittedly gives us more views of the student in one screen. It's about 25. For those that saw Blackboard Collaborate, it's 4 at a time. So yes, I think the visual of students will be enhanced by Zoom. That doesn't mean Blackboard Collaborate doesn't have a tremendous amount of strength, because it does. But again, some of those decisions were based on connectivity and the ability for kids' internet to remain stable. But yes, the expectation is that the cameras will be on.
Okay, I'd say this is for a holy name for Dr. Tartikoff, Matt. What is the protocol if a student tests positive? Who will need to quarantine, etc.?
Matt, I think you should answer this, as you're going to be the one actually dealing with that student and the families as well.
So if a student were to test positive, it goes through the Department of Health, and then they contact trace, and you're going to make a decision on quarantining based on the contact tracing and high-risk exposures. So high-risk exposure is going to be defined as within 6 foot space for 2-minute duration or more without a mask, and then you make your decision based upon that.
And we too will also be contact tracing at Bergen Catholic as well, because the kids in the classes will need to be tested. And as Matt had mentioned earlier, we have a rapid test, and you can come down to Holy Name, and we will arrange for that to be done without an emergency department visit. And most insurers are now covering COVID testing without copays or deductibles. So we can
kind of figure out a vicinity around the student.
We will also aggressively contact trace.
Okay. The next one, I'd say for Mr. McElhenney, if my child is going to school remotely and is in jazz band, will that activity be online or in person? If it's in person, will it still be held later in the evening?
So there's a lot of expectations when it comes to vocal ensemble and jazz being put out by their teachers association or their teachers group. So right now it is all going to be remote. We're going to be utilizing some software that makes that opportunity pretty significant and personable for the kids. But we are going to have it in a remote session. However, this is one of those things, though. If you're choosing to be in a remote environment for COVID reasons, then your concerns about COVID don't stop upon the evening hours when this might have a performance. We can certainly discuss it. I'm not trying to be difficult, but if someone's in the remote environment, the expectation, again, this isn't back and forth, this is the 100% remote, then the expectation is that you're not participating in anything in person. But as of right now, openly, everything's going to be remote in terms of our jazz ensemble, our orchestra, and our vocal ensemble. And we're going to utilize software that makes that very, very meaningful for the kids.
Okay. The next one, also for Mr. McElhenney, will there be changes to the Student Success Center?
There'll be no changes. The staffing remains the same. We have a very nice big space. This isn't as like an academic setting where we might have 18 kids there at a time. We don't. We're going to look at our spacing, make sure everything's appropriate. But in terms of program and in terms of faculty, in terms of scheduling, no change. So no change. Clearly, if you're in a remote setting, we're going to have a discussion. Tonight, I can't say how we would support your student. I'm not saying we can't. We just haven't thought that part through if you're in a 100% remote environment.
Okay. A question again about masks, but it's a slightly different one. Mandated standards regarding mask wearing and the types of masks. Masks with exhalation valves be allowed?
The answer is yes. Ideally, we're not going to mandate a specific mask. We will tell you what we think works best. Certainly cloth masks being the worst. But given the scenario, we want everybody to wear a mask, and we want everyone to be safe. We want everyone to social distance. Again, I think that mandating a specific mask is a bit much for every family, but certainly we would encourage you to use a surgical mask, N95, or any other type of mask that's not cloth, as cloth is often the worst.
Okay. How does the governor's ruling today regarding remote learning related, and if the governor decides to go completely to remote learning due to COVID levels, what would be the protocol for the school, Mr. McElhenney?
So today's decision didn't impact us as it didn't impact necessarily any other school or school district. If a school would like to go 100% remote, they can do so. We would like to go in a 50% hybrid model, and that's what we're going to do. The bigger part of your question is, what if Governor Murphy signs an executive order that every school, regardless of type or age group, has to go in a remote setting? Then we have to follow that order as we did on March 13th. We don't have an option in that regard. Right now, we do have decision-making power, and our decision-making power is to go 50% hybrid model. But it's a good question. Thank you. And I don't know what, and if anything, Governor Murphy would do from now to the start of the school year, but clearly he does hold a lot of power.
Okay. Matt, I'd say this one's for you. Does the school have the ability to facilitate a COVID test if a student is not feeling well, or would the parent need to take the student to Holy Name?
There's multiple different ways that we can obtain a test. If a student is not on the premises, there's a situation at home, we can ideally do it through outpatient testing. If they're on site and I'm available, potentially get the swab done on site. More often than not, it's probably going to end up happening through outpatient testing at Holy Name. It's a 10-15 minute ride from the school. So that would be the most likely outcome. Yes, Holy Name, but we can in some situations do it on site.
Okay.
I'm going to add one last thing, if I may. The goal here is if we think that one of your boys does have COVID, the goal is less contact. So, being in a car with you in a mask is safer than anybody else going into and getting contacted. So ideally, we actually go out to the car in our PPE and do a swab. So that is the safest method with the least contamination. And that's the one I think we would all prefer, and probably the safest for the school as well.
Okay. Another Holy Name question. Will parents be contacted if a classmate tests positive for COVID?
That's the answer is we're going to contact trace. So yes, to some extent, if a kid is positive, one of your sons is positive, we don't necessarily have to tell everybody they're positive, but we do need to know who he was in contact with or had a direct contact with, maskless, and hopefully not for more than 2 minutes. But, we want to contact trace. So the answer is, I think it's important that we let the classmates and parents know, so that they also can start looking for signs and symptoms of COVID to prevent a true outbreak that may actually close the school. This is a difficult and HIPAA compliant issue. We have to think a little bit more about it, but still the goal is that public health and keeping Bergen Catholic, 100% occupied. And I'm not sure we can do that without being able to contact trace and let parents know so that families are safe as well.
So if I may just chime in reviewing FERPA, which is essentially a school version of HIPAA, which is the patient privacy, I think that we can let the school community know that there is a positive, but we can't specify who. So that's where it falls upon us to contact trace and then try to figure out other additional exposures.
If I could just step in. So we did have last semester, during the period where there were questionable cases, of course, Mr. McElhenney and the nurses had to confer about rumors and parents calling because they thought a child with a cough potentially might have traveled out of country or whatever. The privacy of the students is the main priority. There were no positive cases, and as we said, that it would always be confidentiality of students. We're never going to disclose anything, and we're bound by confidentiality for FERPA, and we're not going to let anybody say, oh, this junior or this senior or this freshman had it or their sister had it. We just don't fall into that practice, just to reiterate.
Okay. We've got time for a few more. We're going to finish the questions that have already been posted to the chat, and then we're going to wrap up for tonight. How is the movement between classes being handled to account for social distancing? And also, how will lunch be handled?
Tim, you're muted.
Tim, you're
Mr. McElhenney, you're muted.
Thank you very much. See that? Appreciate that. That's why I shouldn't be principal. Appreciate that. Thank you. And there's a big sign in the middle of the screen says your mic is muted. I apologize, everyone. I gave a great answer, though, and I'm going to move on. But no, in terms of, we're segmenting out the grade levels into 4 areas of the building. We are going to, and we're looking at ways that we could set up the hallways where kids have to move in a single direction and then move back around, so we don't have this mash of kids in there. We're looking at staggering bell schedules, but I got to say, we're trying. That's coming back with some kind of, not great results right now, because if we release one class and they all go to 2 classrooms, they're going to be waiting outside as the class gets released. So we're looking at that as well. So can we set up the hallways where they're moving in a single direction, distanced apart? Also recognize with only 8 or 9 classrooms, there will be a number of students that won't move, that they will stay in that classroom. And that number will help us as we move kids into the hallway. So we're looking at ways to still consider how to keep kids apart from one another. Remember, masks have to be worn. Masks always have to be worn. And we want to make sure that's happening. We're going to be diligent about that. In terms of lunch, now, no one's ever been there necessarily for a lunch period as a parent, but what we're thinking is that the kids are going to have to go down to the lunchroom by my office, which is down the stairs. We're going to release by class and have them come down and keep them distanced as they go to the hallway and then down the stairs. We're going to wait for that to happen after every student gets into their classes. So again, we're not passing kids in the hallway of other grade levels. They're going to be 6 feet apart. They're going to go into the cafeteria. Everything's going to be pre-packaged. We're not going to have the, the order my hero or wrap at the counter. We're not going to have the ability to kind of. We're not going to have a salad bar. So it's going to be a lot of pre-packaged stuff, good stuff, still chicken nuggets and French fries, for the healthy stuff. But we're going to move through there. Now, when we get to the seats, the maximum number of kids we can have in the cafeteria at 6 feet is 108 students. So, which works for every grade level that we have. But we're going to have these plastic shields, and we're going to put 4 at a table. Again, we're using longer time, 40 minutes to make this happen. My hope is that when we get into it, becomes second nature, and we can work it. But we're going to dismiss by class, move them through the hallway, down by my office, the stairway that leads up and down from the lobby, and only one entry point. So we hope that does what we need it to do in terms of both timing and being safe. Sorry for being on mute.
Okay. The next one from Ms. Walter. SAT sites have closed and canceled SAT testing dates. Will Bergen Catholic facilitate SAT testing for the students?
So I'm actually going to let Mr. McElhenney handle this question. This is something that he and I have been looking at closely, and we're evaluating situations. So Mr. McElhenney, do you want to answer this question?
Sure. So today we had a pretty comprehensive conversation with the American College Test, or the ACT organization, about Bergen Catholic being a site only for its students in the fall and in the spring. Now, what that would mean is that if this comes to be, and it's not done yet, so I want to be very clear, it's not done yet. If it comes to be, that means during a school day in the fall, in October presumably, the members of our senior class could sit for the ACT at Bergen Catholic. Then if it works out in the spring on a school day, during the week obviously, the members of our junior class can sit for the ACT. Now, ACT is a lot easier to become a site with than the College Board or the SAT. So we cannot offer the SAT. What we can offer for families, if they would like to take a standardized test in terms of the college process, is the ACT. We think we'll have more information in the next 24 to 48 hours. So while I'm saying it, it's not a done deal yet. For those that are intent and only want to take the SAT, I'm sorry, we can't be a site for that exam. It takes too much to become a host site, and the timing just will not work. So you will have to identify a site on your own in order to do that. But ACT will no more than 48 hours, but that's where we are with that, and we'll have more information.
Al, your mic is off.
That's great. The director of technology doesn't know how to use it either. With that, it's past 8 o'clock, and I know we committed to an hour, and we're cognizant of everybody's time. So if at this point, if you have individual questions, questions that you did not get answered, please feel free to send to anybody that's on the screen, any of the task force, the BC task force members. Certainly, we can relay those questions to Holy Name as appropriate. Certainly tonight's webinar is being recorded and will be available on the BCTV YouTube channel at some point, probably tomorrow. So if you need to go back and review it, you most certainly can. And then certainly please feel free to reach out with any questions. With that, I'd like to thank the members of the task force for taking their time. For everybody, this is our second show. We did a matinee with the faculty before and now with the parents. So I'm thankful to everybody. With that, we hope we provide you with good information. And please, we look forward to hearing from you soon. Stay healthy and stay safe. Good night, everybody.
Good night.
Thank you. Thanks, everybody.
Thank you.
Take care.
Good night.
Of course.